The bulk of the patients I follow, I've been seeing for many, many years. And so I've worked with them closely for many years and gotten insights into their lives and tried really hard to help them with some of the social determinants of health, which have been challenging. The patients I've been seeing, so these are generally men who got infected when they were 20 or 30 years old, and now they're into their 50s, 60s, and 70s.
At the beginning, it was a crisis in the sense that there were no answers, and it was a daily fight to challenge whatever I had wrong that day. And I could come here 1, 2, or 3 times a week. It's in my community, so it's nice and close, so it's kind of been like a second home for me.
Since I started doing this work here in '94, but previously in '89, when I started doing HIV work, it's really changed. I mean, I was going to 1 funeral per week and coordinating care teams, going to people's homes and helping them to together plan their care teams around dying, end-of-life care at home. We definitely do need more housing for people with HIV, housing that's appropriate for people and getting them off the street where their level of health is highly compromised, where they don't have access, they don't have consistency in taking their medications. And really, people with HIV have to take their medications more than 95% of the time, minimally, to have their virus suppressed and their health optimized. The realities for lots of people, if they don't have access to a watch, running water, a regular bed to sleep, and it would be very difficult for any of us to maintain our health. Yeah.
A lot of our patients have really hard lives with a lot of trauma. People make assumptions about HIV. You know, if you develop cancer, you're a victim of cancer, and if you develop HIV, well, it's your fault. And there's that type of insidious, thinking about HIV that, it's the person's fault. And then that's partly what perpetuates some of that stigma. It takes a special person to be able to come to work every day with a smile on their face and to be accommodating and flexible and patient and warm and caring and empathetic and do it for years on end. And I think that's what really binds us together as a family, like our HIV team, but also the whole primary care team here. We really want to be able to provide good, expert, compassionate care to our vulnerable and marginalized patients and families.
Once we got to know each other, I got more comfortable and began to trust them and realized that they were there for me. It just started to work, especially about 7 or 8 years ago when my viral load became undetectable. I'm kind of on cloud 9. It's like getting back into the community. Fort 10 Sherbourne has taken care of all the medical problems I have. I'm still living with medical problems, but I'm finding a better way to cope. And it's kind of given me more hope to have a better life in my 60s and start it all over again.